Okay, this is actually a question I'm also personally super interested in because I don't have the new bridges in my chest. I have the old stabilizer system. So
Yeah.
that's basically what the question is, pros and cons for the bridges. What's going on with those? Am I supposed to be jealous that I don't have them?
No, I don't know. Okay, so let's talk about stabilization of bars. There are a million ways you can stabilize bars, and it's all about the quest to reach zero, right? 0% of patients, I never had a single patient that their bars moved. And, when I first started, I was only doing fiber wires. Fiber wires work really well, but we still had, 1.5% of patients that bars were moving. So stabilizers normally go out lateral. That does not stabilize a bar very well because your point of rotation is medial. That's where your, forces are. So Biomet came out with a stabilizer that you could put medial, and we started using that, especially on this lower bar, because the lower one that you're constant bending over is the one that tilts. It doesn't flip, but it can tilt a little bit. So we started using the stabilizer on that, and it works well. Now we have what are called bridges, and bridges just came out last year, but they basically just connect all the bars together. It allows you to do different configurations, like we can do crossbars now, which people are like, why would you do a crossbar? Well, bars go in the rib spaces, and sometimes your defect is in between those two bars. And so you don't get it lifted up as much. And so you can kind of bullseye it right the deepest point with the crossbars. Um, there's just lots of different choices. And there's a lot of different connectors now. There's three different companies in the US that have them available, and they lock the bars together nicely. Um, my concern with them was, does it make the system really rigid? And it's possible it's a little more rigid, but it's taken our movement rate to 0%. It doesn't prevent it prevents the bars from turning this way, right? But it doesn't prevent them from ripping through your rib spaces and moving posteriorly. And so for that, you need in bigger, heavier patients, we do that hammock stitch where we wrap it around like a hammock around the fiber wires around the rib, and then the bar sits on that fiber wire. Or you have a medial stabilizer, which prevents that bar from moving between the rib spaces. And so they're all good systems. They all work. It's just a matter of, what you like to use and what you want to use. And you shouldn't be jealous that you don't have one, but I think they work well. And so for now, we've been using them. The disadvantage of them is they're a little bit bulky. Same thing with the stabilizer. It's not as flush. It sits up a little bit on the bar. And so you can kind of feel them. So I'd say that's a big disadvantage.